In your health headlines, fainting impacts thousands of people every day, but until recently, there have been no uniform guidelines on how to treat fainting in patients. With more on this is Dr. Mitchell Goldman with UCSD. Thanks for being here, Dr. G.
It's good to be here, and I'm glad no one fainted when that snake got her.
I would be the first one if that was the case. Well, I would assume, Dr. G, that you need to be careful how you handle a patient who's fainted, especially if you don't know the cause behind it. So let's start there. What exactly is fainting?
Well, fainting is basically when for some reason you start to lose blood going to your brain. And that can occur from a variety of reasons. You know, the most common reasons are alcohol and drugs, but there are other reasons that are medically important on why someone faints. And the most common one is a heart arrhythmia. So people that have a problem fainting, it's usually due to the heart. When you faint, you can also be due to seizures, low blood sugars, anemia, but really the most important one that doctors have to worry about is heart problems.
And so when do you know that you need to seek medical attention? Because we hear these things, or at least seen them in the movies, it's a fainting spell. How do we know it's more than that?
Well, if someone puts a needle into you and you faint, okay, that's an anxiety related based on a needle. Or if you are watching like your child being operated on and faint, okay, that's anxiety. So those are common things. If you've been drunk or using drugs and faint, that's common. But if you faint for no apparent reason, or when you're getting up from a chair and all of a sudden you feel lightheaded and faint and actually go to the ground, that's when you should see your doctor. And in the old days, a few weeks ago, doctors would do complete blood tests and sometimes CT scans, and we now know that that's not a responsible way to use our medical abilities. The most important thing to do when you're a physician is a focused medical history and an ECG or an electrocardiogram.
So are those part of the new guidelines you're speaking about?
And those are the new guidelines. The new guidelines are you don't have to go through hundreds of dollars of blood tests and CT scans unless the patient's actually fallen down and hit their head, and then there's a concussion. But if it's just a simple faint, it's usually cardiac related. And so that's what you have to be on the lookout for. And it's so important in young athletes. So if people that are very athletic faint, that's when they really need to have a electrocardiogram and see your physician.
And I've noticed when students are asked to fill out the athletic sports physicals that fainting is one of the big questions they ask about. Have you ever fainted or have shortness of breath when you exercise? Is that what they're driving at?
Exactly, Dr. Kathleen. You are right on, and that's why they put them in those forms. But that's when your kid really needs to see a doctor and get an ECG. And it's a very simple test, and people don't faint from getting an ECG because you're lying down and you just put some electrodes on the heart. But it's a way to tell if you have an arrhythmia, and especially for our young athletes, you know, that's the common cause, the most common reason for a young athlete to actually have a heart attack or their heart stopping is because they have this irregular heart rhythm. And so this is one of the first signs.
Very important information for parents, especially as spring sports are really gearing up. And thank you for the new degree. Before this, Dr. Pepper was as close as I ever got. So thank you.
Okay, well, thank you, Kathleen.
We'll see you next week.